Hello everyone and welcome to another edition of For the Health of It. I'm Lou Beccaria and thanks for being with us. It's always a pleasure to have you join us. We have the pleasure today of doing a very unique and important show on a new surgical system called the Davinci surgical system. And we're here in operating room 8 on third floor of the Phoenixville Hospital to show you exactly how this equipment works. And with us to discuss the equipment are Dr. Arthur Martella, who is a local cardiothoracic surgeon here at the Phoenixville Hospital, and Dr. Panjak, who is a urologist and the medical director for robotic surgery here at Phoenixville Hospital. So, Dr. Martella, Dr. Kalra, thanks for joining us and taking time out of your busy practices to be with us and to provide this public service to the people of the greater Phoenixville area.
Thank you.
So, Dr. Martella, first, tell us a little bit about your background.
I am an assistant clinical professor of surgery at the University of Pennsylvania, but do really all of my work here at Phoenixville. Grew up in the area, did most of my training up in the New York area, but came back here after my training and have been here since. Okay, great. Dr. Kalra?
Well, I actually grew up in Maryland, and interestingly, I went to the University of Maryland and had a background in engineering there, and then ultimately switched gears and went into medicine. And ultimately did my fellowship training at Jefferson Hospital in minimally invasive urology, and I've been working at Phoenixville since then.
Do you find that your engineering background has been helpful with your being in the robotic surgery area?
I never knew how useful it might be down the road, but there's some aspects of it that certainly help.
Yeah, good. Well, the Davinci robotic surgery system, and it is a system. So explain exactly why it's called a system and how does it work, and has it been around a while?
Well, the first Davinci procedure that was ever done was in 2001, in urology at least, and so that makes it very, very new. And it's a system because it's probably easier to show you than to describe it because it consists of two main components. This is the working end of the machine that actually holds the instruments that will be in the patient's body. And you can see that there are 4 different main arms. So we have one of the latest machines that has 4 arms. Initially it was with only 3 arms. And the surgeon will control these instruments at a separate location, usually a few feet away, sitting at a console. So it's a revolutionary concept of operating where the surgeon is no longer directly at the patient bedside, but it actually, believe it or not, has a lot of benefits because with this console here, the surgeon is able to control 4 instruments with only 2 hands. And there's a set of manipulators that the surgeon can control, and it allows these small little instruments to translate the movements of your hands.
Wow. Dr. Martella, what Dr. Kalra just explained sounds pretty complicated. And I know before we went on the air, you were talking to me about the fact that you go around the country actually training other surgeons. Is it very difficult to be able to master these various techniques? It seems very complicated.
The learning curve is fairly steep for this procedure. And more importantly, however, it really involves not just the surgeon, but your whole team getting up to speed. And it really is beneficial that we have both Dr. Kalra and I and other surgeons using the robot because it keeps our team up to speed and involved with this procedure. Beyond that, though, certainly the surgical aspects of it are a little more complicated and require practice.
Now, in your area, Dr. Martella, as a cardiac thoracic surgeon, could you give us an example of the kinds of surgery that you might use for the system with?
Well, there are 2 basic areas that we are using the robot in the cardiothoracic area. One is for the heart, and one area is for the lungs. And in the heart, we're doing this primarily for bypass procedures. Initially, we started out just doing one bypass. Patients who just had a single blockage, we would fix that with the robot. We are now trying to expand that so that we can take care of patients who have multiple blockages on their heart. And that's a gradual process, and certainly it has to be specific blockages now, but it's certainly more than the single blockage that we were trying to tackle initially. As far as the lung area, we are doing this for lung cancer primarily. and for some lung tumors that are very small. Larger tumors we're starting to tackle now with the robot, and we've been very successful with that.
Okay. Could you delve just a little bit more, Dr. Martella, into when you say doing the lung cancer procedures, exactly how does it work in trying to extract a tumor in a lung?
Well, traditionally, we would do this operation with an incision on the patient's side towards their back. We're now using small port incisions to enter the body and remove the tumor as well as the surrounding lung around that tumor, and then remove lymph nodes also. Obviously, the goal with any minimally invasive procedure is to do as good, if not better, a procedure than we would do open. Mm-hmm. And I think we're achieving that with the robot for lung cancer.
Yeah, good. And Dr. Kalra, in your area of urologic surgery, I understand you're doing a technique called prostatectomies. Could you explain to our viewers exactly what that is and how you go about it with the Davinci equipment?
Prostatectomy is basically a very commonly performed operation in urology where we remove the prostate for prostate cancer. And traditionally, since the early 1900s, this has been done open. And just as of the late 2000s, this has been done robotically. It's the same operation, just like Dr. Martella indicated. You're not doing anything different. When you're doing cancer surgery, you pretty much duplicate the principles of open surgery. The advantages of using the Davinci for this are, number one, that it's minimally invasive. Mm-hmm. So just like doing a gallbladder laparoscopically, you get the advantages of smaller incisions. So you're working through little punctures as opposed to through a bigger incision. So patients can go home earlier. They have less pain, less scarring, and they're back to work more quickly. So that's a huge advantage. The second advantage specific to prostatectomy is that the robotic approach helps to minimize some of the long-term side effects of prostate cancer surgery. Mm-hmm. And those are typically urinary leakage and erectile dysfunction, which we very commonly see after open prostatectomy. Now, we still see that to some extent robotically, but because of the much improved visualization, and you have a camera here that you can look in 3D and 15 to 20 times magnification, the human eye, we're able to preserve structures that are very, very important for erections and for urinary control. And we're seeing patients have much less problems with that, mm-hmm. making it a very attractive option.
Good. My guests today are Dr. Panjak, who is a urologist here at the Phoenixville Hospital, and Dr. Arthur Martella, cardiac thoracic surgeon. And we're talking about the new medical equipment, state-of-the-art medical equipment, the Davinci surgical system. Continuing on, now this is such relatively new equipment, and do you find that patients, when you discuss the surgery, saying that you're going to have a robot working through a robot to do this surgery, that they say, whoa, no way. So do you have any patient education that you have to do?
Well, I can speak from my experience that patients today are very savvy, and the information is very widely available. So in my experience, patients come to me saying that they've done their research, they've done their homework, and they don't want it done any other way.
Mm-hmm. How about you, Dr. Martella?
I would agree with that. The patients now have access to a much greater amount of information with the internet. And so they are coming to me also asking if we can do this procedure. Unfortunately, I'm in the position where I have to actually tell people that we cannot do the procedure in certain circumstances, and we have to do it in a more traditional way because there's more people asking to have the procedure done than we can actually do it.
What would be some of the circumstances, Dr. Martella, in which you could not use this equipment, that you would have to use the traditional surgery?
Well, for open heart patients, it would be patients who have extensive disease throughout their heart, or they've suffered significant damage to their heart from their blockages. For lung cancer and for lung patients in general, it's patients who have tumors that are in a more difficult area to get to, mm-hmm. Or they're very close to the heart itself. And those are tumors where safety is a primary issue, And the safest way, unfortunately, still is to do those through a more traditional approach.
Yeah, good. My guests are Dr. Arthur Martella and Dr. Panjak Kalra, and we'll be back in a minute after this word from our sponsor. Stay with us. Hello, and welcome back to For the Health of It. I'm Lou Beccaria, your host, and for those of you who are just tuning in, our guests today, we have the honor and privilege of talking with, are Dr. Panjak Kalra, who is a urologist and the medical director for robotic surgery here at the Phoenixville Hospital, and Dr. Arthur Martella, cardiac thoracic surgeon here at the Phoenixville Hospital. And we're talking about the new state-of-the-art Davinci surgical system that's in use here at the Phoenixville Hospital. Dr. Martella, in your area, in cardiac thoracic surgery, could you tell us, exactly the steps you go through to use this new equipment?
Well, the steps are similar in some ways to the traditional open heart surgery procedures, except we are trying to avoid dividing this bone here, as the traditional open heart operation involves cutting through this bone. We don't want to do that. That unfortunately leads, we think, to more bleeding, more pain and discomfort. And a big part of their post-operative recovery is a significant limitation in the patient's use of their arms, because this bone has to heal. So we really...
How long does it take, by the way, for a thoracic bone to heal properly before somebody can get back to their normal everyday work?
It is in the 2 to 3 month range as a minimum. And so people who do heavy lifting or construction are certainly limited. And even patients who want to play golf or do more vigorous exercising are limited. So the goal ultimately is to avoid doing this incision, and that's really where our goal is with the robot.
Okay. Maybe it's a good time for us to kind of take a break and go over to the machine and the equipment and the system and show exactly what you do when you're doing your surgeries. Okay? Yep. Both of you?
Okay, so this is the surgeon's cart where the surgeon controls every aspect of the operation. And I think the first important thing to point out is that the robot at no time will make any movement without the surgeon's face in the screen and fingers at the controls. So there are many safety mechanisms built in. So the minute I put my face in the screen and activate the instruments, I'm able to start the operation. So I don't know if you can see up on the screen, I manipulated the instruments, and now I'm in control. And basically I have control of my camera as well as these instruments. And I'm able to move this camera by myself without even asking the assistant to hold the camera or move it for me. So that just gives me further control of the operation. And basically these are instruments that are very similar to standard laparoscopic instruments, except they're wristed. So instead of the limited range of motion that you have with standard laparoscopy, you have 7 degrees of freedom here. So I can do complex tasks such as suturing, and I'm really magnified well beyond what you can see with the human eye. So here I'm doing a left-hand suture, and I can do it forehand, or if I want to, I can throw it just as easily backhand, which is very hard to do open or with standard laparoscopic instruments. So you're able to just really control your instruments any which way you want, and really perform very complex tasks like throwing suture in a very precise fashion. So this really enables us to extend the kinds of procedures that we do laparoscopically, whereas before laparoscopy was simply well suited for procedures that involve removing organs like the gallbladder or the kidney. Now, such as prostatectomy, when we have to do complex suturing and reconstruction, suddenly the robot enables us to offer these tasks. Before the Davinci was available, the act of suturing with standard laparoscopic instruments was very, very challenging. And now it's a very easy task. So you can see some of the benefits are that you have instruments that
really rotate any which way you want. So you virtually feel like you have your own hands inside the body. You're able to magnify and zoom in on areas that normally you would never get your face that close to. So you can really see things. We're seeing anatomy that we never saw during open surgery.
Dr. Martella, could you explain to us, actually how you go about using this equipment?
Absolutely. Our initial part of the procedure is the surgeon and my assistant at the patient's side, and that process involves basically what we call docking the robot to the patient. We have to make those little port incisions that allow us to introduce the arms into the patient.
Now, are the patients under general anesthesia when you do this usually, or is it local anesthesia?
This is general anesthesia.
General anesthesia.
And generally speaking, we also prepare the patient to have a standard open heart operation if for some reason we cannot do it with the robot.
Okay. Now, have you ever had a situation where in the middle, or not in the middle, but after you get started into doing this, that you realize somehow that it has to be done in a traditional way, and so that once you get started with the Davinci operation, that you have to switch gears and go into a traditional operation?
We have had a couple of those cases early on in our experience. More recently, however, I think we've been able to select the patients better and do a better job of avoiding that problem. Mm-hmm. But we still prepare the patient potentially to have a standard procedure. Mm-hmm. Once the robot is docked to the patient and the arms are introduced into the patient, then I brake scrub, leave the patient's side, and go to the console back there. Mm-hmm. And at that point, my assistant remains at the patient's side and helps to introduce different instruments through the robot and help with positioning of the robotic arms. Mm-hmm. And beyond that, I remain at the console, which is usually just a few feet from the patient for a large portion of the procedure then.
Right. And how long does this procedure usually take? Dr. Kalra, how about you and the surgeries that you do?
Well, it's going to completely depend on the operation. For prostatectomy, we're about as rapid as the open approach, which is pretty quick. But there's going to be, as time goes on, the robot will be able to be used for many different operations, and the level of complexity will vary from operation to operation and from, for example, tumor size and location. So it's going to take as long as it takes. Just like in open surgery, the times may vary.
Right. But now, for the average person, they would think that, well, this is the kind of equipment that you only see in academic medical institutions like the University of Pennsylvania. Is this becoming more common now in community hospitals in suburbs like where we are here in Phoenixville?
I think that ultimately, because of overwhelming patient benefits, we're going to start seeing this more and more in community hospitals. Currently, at Phoenixville, we were one of the first community hospitals to introduce this type of technology. Mm-hmm. And in this short period of time, we've been able to kind of amass quite a level of experience that I think sets us apart from other community hospitals. I mean, we've done a large surgical volume. We have multiple specialties who are utilizing the Davinci, and like Dr. Martella alluded to, we have a very experienced team, and that team is integral in the success of the operations.
Yeah. You may have mentioned this before, I think it was Dr. Martella, about the team approach, but again, who are the members of a team, of a Davinci robotic surgical team? It's obviously the surgeon, but who else assists the surgeon during this process?
Well, for my procedures, and I think also for Dr. Kalra's procedures to some degree, I have my physician assistant who is typically assisting me directly at the patient's side. And then we have a very experienced nursing staff who are involved. Mm-hmm. And then we also have our anesthesia team, mm-hmm. which is very critical to making sure these procedures go well. Their access to the patient is a little different because the robot is close to the patient. They don't have the same access that they have with a standard procedure.
Right.
So they've had to adjust things a little bit. And then we have our coordinators who help us keep things moving along.
Yeah. Dr. Kalra, would you say that now that we have this equipment here at the Phoenixville Hospital, that it puts us way ahead of our competitors here, or your competitors here in the area, in the region?
I think that we are, in terms of having the level of experience, beyond just having a robot, I think ultimately a hospital can make the investment and have the technology. I think it's important to realize that it's also the surgeons who are using it and their comfort level, their training, and their experience. And I do believe, since we've just been around the longest and have done quite a diverse number of procedures, that we're just in a good position to really offer this with a lot of confidence to our patients.
Yeah. We know that in medical technology, it changes pretty quickly. Do you see the Davinci system actually evolving into something even more sophisticated and of more benefit to the patients coming down the road in terms of the research that's going on, technological research that's going on?
Well, I think that the robot itself is evolving, and in that there are newer versions of the robot coming out. And in addition to that, at least in the cardiac arena, there are other technologies that are complementing the robot and allowing us to do even more involved procedures, handle patients who have more extensive blockages with the robot. And those things, some of those things are here now, and some of those things are coming down the road in the next 6 months to a year.
Dr. Martella, I understand that you're one of the few doctors in the region, or maybe in the United States, that does this kind of surgery with robotic surgical system in the cardiac thoracic area. Is that correct?
That is correct. I am one of probably about 4 surgeons in the tri-state area that is using this for cardiac procedures, at least on a regular basis, as regular as we can do it. And probably one of the only surgeons right now in the area that is using it for removing lung cancers.
Now, are you training other doctors across the country or in the region to
I am participating in that also, yes.
Good. Okay. Well, both of you, thank you very much. It's been a great public service to be able to introduce the Davinci system to our viewers. Thank you, Dr. Kalra.
Thank you.
Appreciate you taking time out. Dr. Martella, thank you. And thank you for tuning in to For the Health of It. It's been our pleasure to bring you this very unique and significant show on the Davinci surgical system here at the Phoenixville Hospital. I'm Lou Beccaria. It's been my pleasure to be your host. And remember, if you're healthy, you're wealthy. I look forward to seeing you around town. Take care.